Welcome to This Explainer. We're diving straight into a massive structural crisis affecting millions of people right now. We're looking at the German healthcare system. It's a system historically famous for its efficiency, but right now, it is buckling under some immense pressure. So we're going to break down exactly what's happening, why it's happening, and what it all means for the future of patient care. If you've tried to find a specialist in Germany recently, you've probably felt incredibly frustrated. You call clinic after clinic, right? Only to be told they just aren't taking new patients, or maybe the next available slot is like 6 months away. Well, I want to validate your experience for a second. Have you had trouble booking appointments? Because if you have, you are absolutely not alone. And this isn't just a string of bad luck. It is a massive systemic issue. In fact, experts are literally calling this one of the biggest structural crises of recent decades. It's driven by this incredibly complex web of demographic, economic, and political decisions that have been piling up for years. So we're not just looking at some temporary glitch or a few understaffed clinics here.
To figure this out, we're going to act as medical detectives today, diagnosing the crisis step by step. First, the symptom, waiting lists. Second, the root, the political factor. Third, demographics, the retirement wave. 4, the weight of bureaucracy. 5, the gridlock of current reforms. And finally, 6, the final diagnosis. Okay, let's jump right into section 1, the symptom, waiting lists, and the reality of waiting lists.
So the immediate symptom patients are feeling is that clinics are just outright rejecting new public insurance patients. If you're on statutory health insurance, the GKV, you might find that the doors are practically shut. This is creating these massive bottlenecks, especially in major cities like Berlin and wider regions like Saxony. Patients who genuinely need specialized care are essentially locked out of the schedule. But you have to ask, why would doctors just stop taking patients? To understand why those waitlists are completely locked, let's look at Section 2, the root, the political factor, and the budget system. The core political factor here is this policy known as budgetiering. Basically, the German government imposes a strict budget limit. This cap dictates the maximum total amount that public health insurances, think of major providers like AOK, TK, or Barmer, are allowed to pay out to doctors every single quarter. It's a hard, non-negotiable ceiling on healthcare spending per clinic. And the trap looks exactly like this. Step 1, the government sets that quarterly payment limit. Step 2, because of incredibly high demand, a doctor quickly reaches that assigned patient quota midway through the quarter. And Step 3 is the inevitable consequence. Once that limit is hit, if the doctor continues to treat public patients, they're effectively working for free, or at best for a tiny fraction of the cost. To avoid running their clinic at a massive financial loss, doctors are forced to freeze public appointments. They aren't trying to be difficult, it's just that the economic design of the system literally forces them to lock the waiting lists. As if that financial bottleneck wasn't enough, we have to look at Section 3, demographics, the retirement wave, and the aging population. Right now, we're facing a three-pronged demographic threat, hitting the system all at once. First, we have the baby boomer generation of doctors. These are generalists and specialists trained back in the 80s and 90s who are now retiring en masse. Second, there's a severe lack of successors. Young doctors are looking at the traditional full-time clinic model and just turning away because of the high maintenance costs and intense administrative stress. And third, while the supply of doctors shrinks, patient demand is spiking. The broader population is aging, which means there are way more elderly patients requiring continuous, complex medical care than there were, say, 10 or 15 years ago.
Which leads perfectly into Section 4, the weight of bureaucracy and the administrative burden.
Take a second to really absorb this number, 60. This staggering number represents the estimated 60 days per year that a single doctor in Germany spends solely on paperwork. We're talking insurance reports, mandatory forms, endless administrative tasks. That is roughly 2 whole months out of every single year, where a highly trained medical professional is sitting behind a desk doing paperwork instead of actually treating the patients waiting in those locked queues. It is a massive, massive drain on an already depleted medical workforce. This inevitably brings us to the halls of Parliament and the Health Ministry for Section 5, the gridlock of current reforms and political gridlock. So the government has tried to intervene. Recently, they actually passed a reform ending the budget limits, known as Entgegierung, for general practitioners, the family doctors. And this was a success in that it genuinely improved access to generalists. But specialists, like psychiatrists, radiologists, neurologists, they were completely left out of this reform. They are still entirely restricted by the old quarterly budget limits.
So you might get in to see your family doctor quickly, but the waitlist to see the specialist they refer you to, that remains totally blocked. Local governments have tried other solutions too, like centralized diagnostic platforms to kind of organize the chaos. For example, in Berlin, they set up a centralized system for autism diagnosis. But here's the catch. These platforms don't actually create new medical slots. When the demand is 10 times greater than the actual supply of hospital beds and doctors, centralizing the system merely organizes a very, very long line. It manages the queue, sure, but it doesn't cure the shortage. Now, if there's so much demand, you might be wondering, why don't new doctors just open more clinics to meet it? Well, that brings us to the Kassensitz. A Kassensitz is an official accreditation code. A doctor cannot simply rent a space, open a clinic, and start billing public health insurances like A-OK. No way. They absolutely must have one of these limited government-issued codes to operate within the public system.
And here is where the economic reality really bites. The public health insurers are currently facing multi-billion euro deficits. Because the system is bleeding money, the government actively avoids releasing new Kassensitze. They're essentially freezing the number of available accreditation codes just to cap spending. So even if an ambitious young doctor wanted to brave the bureaucracy and open a new public clinic to clear those waitlists, the door is officially locked by the state.
Bringing all these symptoms, demographic shifts, and root causes together gives us Section 6, the final diagnosis, the perfect storm. When you contrast the past with the present, this remarkably clear picture of a perfect storm emerges. Think about it. The German healthcare system was designed decades ago for a much younger population, an era of significantly lower operational costs and a steadily growing medical workforce. But look at the current reality. That same legacy system is now trying to support an aging population with chronic needs. It's buckling under massive public insurance deficits, and it's facing mass retirements while simultaneously freezing the ability of new doctors to enter the public market. You can really see how all of these factors, the strict budgets, the aging doctors, the 60 days lost to paperwork, and the frozen clinic codes, interlock to create those incredibly frustrating waiting lists. So I'll leave you with this provocative thought. With all these interconnected bottlenecks firmly in place, how can a system designed for a bygone era possibly adapt to cure the patients of tomorrow? Thanks for joining us for this explainer. We'll see you next time.